I'm Dr. Malik. Let us talk once again about a topic of reversing metabolic syndrome. Reversing metabolic syndrome. In fact, we dealt with this topic earlier also. I told you that about 3 years back, when Corona was there, during Corona time, I was around 57, 58 at that time. Now I have crossed 60. Now I am reaching 61. My age is 60 crossed, and I am almost getting 61 completed, 60 crossed. So at that time I was about 57, 58 my age, and you can understand the amount of work during Corona time. I was already a hypertensive. I was already having hypertension. I was already having diabetes. I was already having diabetes at that time. And my weight was roughly around 80, 81. That was my normal weight, 78 to 80. I fluctuate. I fluctuate between 78 to 80. That is my normal weight. So during Corona time, I neglected myself because of the work or whatever it is, whatever. So nearly for about 1 or 2 years, I didn't care about myself. I was taking hypertensive medication, diabetes medicines, etc., etc. But once I checked my sugar levels, it was fasting was 290 and post lunch was 380 after the Corona time, and my weight went up to 96 kgs, nearly about 16 kgs weight gain. And my BP was not getting controlled even after taking 4 tablets a day, 2 tablets in the morning, 2 tablets in the evening, different types of antihypertensives, different types of hypertensive medication, BP tablets, types of BP tablets, 4 types of BP tablets I was taking. Still my blood pressure is not coming below 140/90. Then I realized that I have to do something. I have to do energetically something. This is 3 years back. So I shifted immediately. I referred so many books, etc., etc., so many diets. Then I shifted my diet to grossly have shifted my diet. What you have to do at that time, I just wanted to know. This is called reversing metabolic syndrome. Reversing your this is called metabolic syndrome. What does metabolic syndrome consist? So obesity, mainly weight gain, hypertension, increased blood pressure, diabetes, uncontrolled diabetes, PCOD in younger females, newly married females, etc. They will have small cysts in the ovaries. This is called PCOD. Hirsutism is unnecessary hair in unwanted places, and infertility, male, female, both of them infertility because of diabetes, hypertension, hypothyroidism. Hypothyroidism is one of the important features in these people, and all put together this is called metabolic syndrome. And metabolic syndrome is very common nowadays it is starting from teenage onwards, particularly in people who are getting newly married people. We are seeing this syndrome. So this is what is happening. How to reverse it? As I was always telling you, 80 is to 20. 80% is your diet. 80% is your diet, and only 20% is your exercise. 20% is your exercise. Don't neglect exercise. 20% depends on exercise. See, regarding exercise, it is very simple. I have been stressing on only one thing. Alternate days, let us put a schedule. One day you go for walking or cycling. Cycling means exercise or cycle at home. That is cycling. Okay, exercise or cycling at home, or you can go for walking, whichever is convenient for you. Walking or cycling at home only, exercise or cycle. The other day do push-ups and sit-ups. These two things at least for half an hour to 45 minutes. Push-ups, sit-ups one day. The other day cycling or walking for about half an hour to 45 minutes. This is a must. Then come to food. What exactly you have to do? What I have done is exactly stop rice. No question of eating rice. No question of eating wheat. No question of eating maida. Coffee, tea, stop for a while. Milk, stop it please. Don't take milk. Sugar, absolutely no question of sugar at all. Sugar and jaggery also. Jaggery also you have to stop. Particularly the jaggery which comes from sugar cane, you must immediately stop. Jaggery from toddy tree, you can take little bit. Toddy tree, you can get jaggery. That you can take little bit. That also little bit, not more quantities. But jaggery from sugar cane, urgently stop it. And oils, please don't purchase oils from ordinary kirana stores and all. I mean supermarkets and all. They all contain mineral oils. They don't really contain the seed oils. No? For example, groundnut or til oil or sunflower oil, whatever it is. But you don't get really half content is only mineral oil. Please try to avoid. In this place, you have to take compressed cold pressed oils, village made oils. Okay. Then what I have done? I have stopped all these things. No rice, no wheat, no maida, no milk, no sugar, no jaggery, and then I have shifted to millets. I had to shift. It's the only decision you can take at that time, because reversing your diabetes, reversing your metabolic syndrome, reversing your obesity is a must. From then onwards, you are launching to other problems. So first thing you have to shift is millets. Please, you can see millets. Please see Kadarwali sir's lectures. Or earlier also I told you about same. What Kadarwali sir told me, I followed. That's all. 5 types of millets. 5 types of millets. Two days one millet. The other 2 days the other millet, like that. 2 days. 2 days or 3 days each millet. So 5 types of millets. You must please concentrate on millets. And then quinoa, you know that. You know the grains of quinoa. Excellent food, full of protein, quality protein. And how I take millets, particularly for breakfast, I take fermented millets. For breakfast, I take fermented millets. Why fermented millets? Previous night cooked, and next day morning I eat them. I cook them one day before, previous night, 9 o'clock, I keep them, and next day morning around 7:30 breakfast, I take that millets. This is fermented millets. Why fermented millets? To get plenty of bacteria, useful bacteria to the gut flora, gut intestinal flora, from mouth to the anus. The 10 to 12 meters of intestines you have, they must be full of good bacteria. These are very useful for your digestive processes. Not only your digestive processes, your whole health. Previously, I dealt with it. Bacterial flora and inflammation. I have covered a topic. Please try to see that. So millets, morning 7 to 7:30, you must take breakfast. Early breakfast. Always early breakfast. Before 8, you should finish off breakfast. Fermented millets is the best. You can add little curd or buttermilk. And in that you can add some pickle, our household pickles, excellent in bacteria. And number two, so breakfast millets, lunch millets. This is breakfast fermented millets I prefer. Lunch as usual millets, not fermented, normal millets. And vegetables, non-veg curries, eggs, etc. liberally you can take. Vegetables, any type of vegetables, please take. Only thing is, fermented millets, if you take in the breakfast, it is the best. It will totally transform you. And number 2, breakfast. After that, lunch, please take normal millets, cooked millets. And then dinner, I prefer quinoa, that is quinoa. Dinner with quinoa. Same again. You can take non-veg, eggs, etc., anything, and all types of vegetables. And cold pressed oils only. Cold pressed oils. The best oil is going to be ghee. Ghee is number 1. Second is coconut oil, and groundnut oil, til oil, etc. These are all cold pressed only. And kheera and coconut use liberally, because coconut must be used liberally. Coconut must be used liberally by all diabetics and all metabolic syndrome patients. And kheera particularly, it's a low calorie food, and it fills the stomach, and it causes avoids constipation. As such, millets, quinoa, all these things, they avoid constipation. They are full of fiber. They are full of fiber. So millets contain 9 to 12% of fiber. Quinoa contains about 5 to 10% of fiber, whereas in rice and wheat it is only some 0.2% or 0.3%. So kheera and dals, take plenty of dal. Any dal, sene dal or any dal you can take. Dals you can take liberally, and legumes can be taken liberally, beans, etc., etc. So please plan your diet accordingly. Coconut can be taken liberally. So plan your diet accordingly, and please try to avoid this rice, wheat, maida, milk, sugar, all processed foods. Stop all processed foods. No processed foods at all. No cool drinks. 3 to 6 months. Be cautious. So automatically you can reverse. Then followed after that, you can think of yourself. This is always the best diet it is going to be. Please.